So this is an article having to do with the Tuskegee syphilis study and in regards to COVID-19 vaccines. And I just want to say I'm going to be honest here. I have not seen any vaccines given out I'm just talking about one general area. And so if I'm ringing any bells for anybody in their areas, that if you're in an area where it's more vulnerable individuals, people of color, minority, black, people who don't make a lot of money, or who basically you're someone who you're a working individual, but you might have been laid off temporarily due to COVID-19 or the pandemic. This would be in regard to people in that category. I've seen the vaccine sites, but the availability for getting the vaccine I have not really seen. And I've heard some crazy stories that some people have died. Then I've heard stories that are trying to say that there's no proof that the vaccines can kill people. And I believe originally what happened in the black community is that a lot of people were looking at how the government in the past has treated the black community or people of color, minority people, when it comes to crises such as this. And they always go back to the Tuskegee experiment. Or as it's said here, decades later, the infamous Tuskegee syphilis study stirs wariness in the black community over COVID-19 vaccines. So there's still the fear. The other thing that doesn't sit well, I think, with a lot of people is that you have healthcare workers who are refusing to get the shots for some strange reason. Then we've heard that they have to sit with people after they get the shot for about 15 minutes. And so I think that's scary, because let's say you are not really allergic to anything, but this shot, you get it, and all of a sudden you have an allergic reaction, even though you might not be allergic to other things. You don't know if you're going to be one of the ones that could end up having a really bad reaction from this shot. Then I've seen some crazy stories where the people say that they're mixing and matching the vaccines. Like they'll take one vaccine and then they'll go, if they got Moderna the first time, the second time they'll get Pfizer or Pfizer, if I'm saying it correctly. They'll get a different vaccine shot. I don't know if that's a good idea. Mixing and matching the vaccines. I've heard crazy stories like then there's people who don't even live in the area who are posing as frontline workers or healthcare workers, and they're maybe even lying about their age. Somehow they're falsifying information and they're coming to different areas to get the vaccine shots, or waiting so that if there's a shipment and if they don't want to throw it out, because we've heard of the crazy stories of them having an abundance of vaccine but not enough people to give it out to, so they end up trashing it. So what they've gone and done, if anybody is there, it's first come, first serve. And so you may not even be 65 and older. You may not be in a vulnerable class. You're just somebody that comes from wherever, and you found out that this site has, late shipments, and you get in line or you wait long enough so that you can be one that gets the shot. And so that's a shot that maybe somebody who was in a vulnerable situation or population of community that may have needed it, and they're not getting it. And so I haven't seen a whole great abundance of people in South Los Angeles running to get shots. for several different reasons, such as what I've said. So this article here, I guess, is talking about some of the fears that people already have shared. And I believe this guy was one of the ones. This is by Curtis Lee. And did I say that right? Yeah. So this article shows this man here. His name is Omar Neal, whose uncle Freddie Lee Tyson was a victim of the Tuskegee syphilis study. So he knows the story behind it. So Omar Neal often thinks back on the calculated betrayal of hundreds of black men and how it still shapes so much about this rural Alabama community. And so this is in the South, and so a lot of people are scarred from those memories, and the kids or grandkids and so on. So he remembers the mechanic who went from a house to house fixing cars, and the sharecropper who lived off a narrow dirt road. And he thinks too of his uncle Freddie Lee Tyson, a carpenter, and how the betrayal shaped his life. So these men believe so-called medical experts were deceived, said Neal, a lifelong resident of Tuskegee. So the name of the town evokes feelings of both pride and pain for its legendary black airmen and for the infamous government-backed healthcare study. For now, the legacy of a study in which black men with syphilis were left untreated for decades stands front of mind for many contemplating whether to get the COVID vaccine recommended by federal officials. So Neal's uncle, among the more than 600 African American males from here who were enrolled under false pretenses in the deadly long-term health study coordinated and financed by the federal government beginning in 1930s. So because the government researchers behind the Tuskegee syphilis study wanted to track the disease full progression, they treated the black men in the study like lab rats, withholding for decades life-saving treatment under the guise of free health care. So these are some of the men who were the victims of the Tuskegee syphilis study back then. So this is out of Tuskegee Human and Civil Rights Multicultural Center, and so you've got a picture of them here. And so before the full scope of the medical negligence was exposed in the news reports in the 1970s and later memorialized in congressional hearings, a stage play and film, more than 24 men with untreated syphilis died, and roughly 100 died of complications related to the disease. So a trust in medicine, especially when the conversation is beginning with the federal government, is almost a non-starter here, said Tony Haygood, mayor of Tuskegee, 40 miles east of Montgomery, the capital. So the trust in the government to do the right thing has long been broken. So Tuskegee Mayor Tony Haygood outside the city's municipal complex is pictured here. So that history is on his mind, Neal said, when he thinks about COVID-19 pandemic and the government-led efforts to get as many Americans vaccinated as possible. And so it takes a lot, he said, for the community to rebuild the trust in healthcare. Being it shows of the history of what has happened so far, so raw memories of the healthcare atrocities still echo through the thick woods that blanketed this part of the Deep South, and they have only grown louder in recent months as devastating coronavirus data confirms what many here have long known: access to healthcare in America remains devastatingly unequal and shaped in part by structural racism. So it's basically validating what I've said. You know, there's vaccine chasers, and some of these people are in a wealthy class. They're not living in these communities. They come from outside of the community and they come to chase the vaccine and basically have the shot, or they lie, cheat, steal, manipulate, cut in line before people who need the vaccine. So this is a case of people needing a vaccine and not having access to proper health care, and then having all these other issues in the history of these communities and not having a lot of trust in the government to pull through. And then all these stories we're hearing of the vaccine in and of itself is very scary. Hearing about people possibly dying or having really bad reactions to it. And then we keep hearing people come out and say, oh, it's not the vaccine. But then you got people coming from outside, chasing to get the vaccine. You don't know if you're going to get the right thing or the wrong thing. I even seen a story of some time back where they said the cocktail that Trump had somehow ended up in a batch of the vaccine shipments. And so that's scary too, because that's not really, I don't believe, proven to actually work. I felt like he was experimenting with different things. And, when you have money, I guess maybe you feel invincible to some degree, like your money will shield you from a lot. So, unfortunately, these communities, people don't have the luxury of just being able to pay their way through their troubles. So it goes on to say, the raw memories of the healthcare atrocities still echo, which is true. So it's grown louder in recent months. So access to the healthcare in America remains devastatingly unequal, which is true. So throughout the pandemic, Black, Latino, and Native American people have died at disproportionately high rates, according to the Center of Disease Control and Prevention Statistics. So yet, at least partly as a result of the painful medical history, some Black people appear to be less inclined to be vaccinated against COVID-19, a measure most but every reliable medical authority says will provide protection to individuals and the public at large. So a lot of people are afraid to even get the vaccine because they're thinking that could cause their death as well. How do you know you're getting the right thing? So this U.S. Public Health Service worker denied treatments to Black men suffering from syphilis for 40 years. In a historical photo, a man receives healthcare treatment in a field. So this was part of that Tuskegee study. So this man actually was getting poison, and he was getting syphilis injected into him. And so he was denied the treatment to cure the syphilis. So there are historical trust issues due to the failed and lack of the research integrity in the past with such studies as Tuskegee, said Martha Dawson, president of the National Black Nurses Association, who is based in Birmingham, Alabama. We still remember these cases and acknowledge the egregious behavior of the government and scientists alike. So here, as in much of the country, rollout of the vaccine in predominantly Black communities, both urban and rural, has lagged behind other areas in the state. And so it's true. It's what they're saying is more people who are not people of color, they're not minority groups or vulnerable groups, more white people, wealthy people, people who are not really in the more vulnerable class in terms of, financial, I guess, to be in communities where you have to live with more family members, you can't really social distance, or you're working in jobs where you're in close contact or proximity with other people every day. You're working in jobs where you can't just go home and sit behind a computer to make your money. You have to go out to a place to make your money, which puts you in more of a risk because you're more around people. So these people that don't have those issues It seems like the ones getting the vaccine are able to have access to the health care are the ones that are not in the vulnerable class. And so earlier data from 23 states showed white residents vaccinated at higher rates than black residents, according to an analysis at Kaiser Health News, which is not a surprise to me. So in neighboring Mississippi, like I said, even here in South LA, I have not really seen large swaths of black people going and getting, oh, okay, it's our turn, let's go and get, and then the morale is not there either because of the not feeling safe, not feeling like you can trust it, that it's gonna actually keep you safe from what's going on, what's spreading out there. Some people don't even believe it, still, after all of the death. And I guess it's just, people are in their homes. They're allowed to go to the grocery store, allowed to go to some places, but and some people are trying to muddle through. There's some people still working and putting themselves at risk. I hear people coughing where I live, but the trust is not there in all of this. So, in neighboring Mississippi, it says black vaccination rates are at 2%, compared with 5.8% for white people. So this is talking about Los Angeles, which I'm in South LA. It says officials have expressed concern about disparities, noting that the healthcare workers in South LA, which this is where I'm at, are predominantly black and Latino community, that have been vaccinated at a significant lower rate compared to healthcare workers in other regions, which is not a surprise. So with roughly 3% of the American public having been fully vaccinated, the disparity experts say point not just to the unequal access, but also to the deep-rooted distrust of medical institutions as well. So partly when their efforts are backed by the federal government. So a nationwide poll conducted by Pew Research Center in December found that black people were less inclined to get vaccinated than other racial groups, ethnic groups. 42% said that they would do so, compared to 63% of Latino and 61% of white adults. More recently, a poll from the National Foundation of Infectious Disease found a slight uptick in 49% of the black adults saying that they plan to get vaccinated. But hesitancy is something that Haygood, Tuskegee mayor, has heard often in the recent months. So he represents the city in which 97% of the residents are black. So it's a large population that are black residents there in the South. So he talked to dozens of constituents about the pandemic, about their concerns about vaccination. So back in December, he estimated about close to 60% of the constituents would have opted against getting the vaccine. But now he said that he thinks that a number is closer to like 40%. So the death last month of a baseball player who was legendary, Hank Aaron, an Alabama native, just days after getting vaccinated in the campaign to encourage more black people to get shots, has led to an increased chatter online about the hesitancy. So if you didn't know, that legendary baseball player, when he got the shot, he died not very long ago after getting the shot. And so that's what's scaring people as well. And we've heard other stories that's been pretty scary, but only to a point. So many black healthcare workers have already been vaccinated, including the first person in the nation to receive the vaccine in mid-December. So a black nurse who said that she hoped to inspire others who look like her, who might be a little skeptical of the government advocated vaccine. So much of the community, experts say, feels quite open to the idea of getting vaccinated, but so long as for the shots are administered by medical professionals and they're even more comfortable in if the medical worker is black as well. So others have long been wary of the vaccines of any type, including annual flu shots as well, because we've heard stories about even the flu shot. So African American and black races and ethnicities have similar questions and concerns regarding the vaccine as others, said Dawson of the Nurses Association. Since we've come from diverse backgrounds and experiences. We've had to avoid promoting the concept that we all think alike as well, which is a great idea because we all don't think the same way. Even though we may have some similarities, we come from different cultures, backgrounds, upbringings, and sometimes our thinking process is not similar. And our culture experiences is not always the same. So, but we do know that racism is very prevalent towards people of color. So the infamous syphilis study began here in 1932 in the countryside on the outskirts of Tuskegee with a group of black sharecroppers during the height of Jim Crow. And so you see here U.S. Public Health Service workers who had fanned out across the rural stretch of the farmland and forest for years insisted that they were providing free health care but withheld treatment from the unsuspecting black men who had syphilis. So after patients had died, the federal government did autopsies on their bodies for research. By the later 1940 penicillin antibiotic that kills the organism and causes the disease was widely available, and yet doctors did not provide it to the men that were in the study that they were studying on. The study didn't end until 1972. So when it was revealed by Associated Press. So in the years that followed, civil rights attorney Fred Gray represented several victims in the civil suit, which resulted in a multi-million-dollar settlement and a 1997 apology by President Clinton. And so here is civil rights attorney Fred Gray discussing this Tuskegee syphilis study in the Tuskegee Human and Civil Rights Multicultural Center. He was a lead attorney in that case when that whole thing took place. So for a long time, I was the only voice that they had, said Gray, who is 90 years old here, and was also a counsel to Rosa Parks after her arrest in Montgomery in 1955 as well. So as part of his advocacy, he said that he has worked with families of men in the study and helped open the Tuskegee Human and Civil Rights Multicultural Center here in their honor as well. So allowing those men to go that long without treatment was an American tragedy, said Lily Head, whose father, Freddie Lee Tyson, was a victim of the study. Black folks have been treated so unfairly ever since we came to this country, not just medical and overall healthcare, education, you name it. And so Head, who is Neil's cousin, said her father, an Alabama native, worked as a sharecropper before moving on to carpentry. And he helped build Moulton Field, the flight facility where the all-black unit of the military pilots known as the Tuskegee Airmen trained to fly, which you saw the movie Red Tails was sort of, I believe, the movie about the Tuskegee Airmen. And later in life, and his family moved north to Connecticut, part of the Great Migration. So Carpenters Union steward. He had congenital syphilis but died from injuries in a car accident in the late 1980s, she said. So right here is a barn in the rural Macon County, Alabama, outside of Tuskegee. And so my dad loved rural Alabama and he loved his community, she said, but he was failed by his own government. So Head now oversees a group, Voices for Our Father's Legacy Foundation, which includes descendants of those in the study who gather for meetings over Zoom. So Janine Holmes, whose great-grandfather Alex Ware, a sharecropper, was a victim of a study, is a member of this group as well. Holmes, 73 years of age, who still lives on a parcel of land here in rural Alabama, thought about her great-grandfather a lot recently as COVID-19 vaccines rollout had began. So the treatment was despicable, Holmes said on a recent evening adding that particularly the poor care of black people continues to plague the American healthcare system even to this day. So I'm adding that this treatment still exists, of course. So this history is not that far off. So Holmes, who is somewhat skeptical about getting the vaccine, said that she planned to take a wait and see approach. That's what honestly, my family and I, we kind of wanted to do the same thing that she's saying, this Holmes lady, that we kind of wanted to see what was going to happen. We have seen a lot of crazy stuff. Other people in the community where I'm at, we've seen people get sick or they die, or, and it just raises more fears of skepticism, of course. So, this lady said she's skeptical of getting the vaccine. Um, Wanting to avoid being the one of the earliest to get it. So while she had some concerns about side effects, and I agree with her, Holmes said that she has been reading research that will probably and will probably get vaccinated this spring. So it seems like you want to wait longer to see what's going to happen to people. So, like with anything, she said, it was always good to do your own research. She's correct. So, Janine, I believe her name, Janine Holmes, holds a photo of her great grandfather Alex Weir, who was a victim, or whom was a victim of the Tuskegee syphilis study. So Haygood recently got his first dose of Moderna vaccine, and the video of the injection was posted to the city's website as well. So his predecessor, Johnny Ford, also received his shot in front of the television camera, urging a trust in the science. And so this is what they have to do. So sad because of what has happened, that they have to do this for people in the black community who's specifically vulnerable to this virus and to the devastation that it's already caused. So back at the time, our people were victims, Ford said. So today we are part of a solution. So we have African Americans who are involved in science, and also they're involved in developing the vaccine the same way. So we are part of a solution. We will never forget what happened 40, 50 years ago with the infamous study. He added, but this is 2021. And my message today is I'm happy to be able to take the vaccine because I believe in science and I trust God, and I'm encouraging others to do likewise. So despite its historical importance, metal placards around town recognize parks. A local hero, Tuskegee, has shrunk over the years, and the result of the white flight to Montgomery and the college town of Auburn. So also a new highway several miles outside the town makes it easy to drive past. So on a recent afternoon, the town square in Tuskegee, where a Confederate monument sits draped in the blue plastic, Neil and Holmes, who had not seen each other in several years, talked about the community they loved in spite of the pain their uncle and great-grandfather experienced. So there is pride in Macon County. Neil, who is 63 years of age, who served as a Tuskegee mayor in the early 2000s. So the Civil Rights Monument study, Holmes said, trailing off as she thought about it like a bad memory. So at the time, neither of them had yet gotten the vaccine, but Neil mentioned that he intended to and hoped that Holmes would do the same. So we all know the history here, and we're victims. We were victims of our family's members that were victims, he said. So, but this is different. And so this is a health emergency. And if we have the access to this vaccine, we all need to take it. So HEAD, in the long run, aims to remember that these men are also to change the narrative around the study. And so the way the history recalls the study, she says so much emphasis falls on the place it happened, Tuskegee, a town known in academia for its historically black university, his military veterans, civil rights icons, and far too little on perpetrators. So the study head believes it should be referred to as the United States Public Health Service syphilis study in Tuskegee in Macon County, Alabama. So this is a small step, she said. This was the U.S. government's wrongdoing. So the story originally appeared in the LA Times. So this is a long, lengthy story, but I was able to get through it. It's just that I thought it was pretty neat to see people who actually went through this and kind of get to see the pictures of some of the people who actually experienced this, the town where a lot of this happened. It's sad, but even till this day, people are still not really completely trusting, which it makes a lot of sense. I've done a video on something similar as this before, but to bring it to what's going on here in South LA, I have not seen a lot of black people running to get shots. And then those who want to get them can't even access them because we have what they call as vaccine chasers. And these people, they literally come, you can see them wearing shades, and they have big coats on, or they're hiding their identity, or they're acting like they come from the community and they don't come from the community, or maybe they grew up in this community years ago and they came into some money and they left and they know the community, but they turn their back on the community. But now that this health crisis is an issue, they come back to the community to get the shot above somebody who probably is not financially equipped to have access to health care and access to the shot like these other people do in these other communities that are in far better shape. And somehow there are some people that are getting richer during the pandemic, and the poor seem to be getting poorer during the pandemic. And so that's an unfortunate as well. It's pretty sad. But anyway, having said that, I'm going to let this video go. But this is what's been going on. It has been really sick stuff, y'all. I mean, to add more to this, I've seen where people look like they have, believe it or not, and I want to be honest about this. Even where I'm living, I thought it was just a couple of people that weren't, a few people that were struggling. I know most people were struggling, but I didn't know it was to the magnitude. I've been made aware that there are apartment buildings, I'll say it like this, that the whole building, almost the whole building, maybe one or two people are paying anything on rent. There are buildings like that. And what happens is for the owners that are able to deal with it, they, if they have other properties and they're able to get money and they're able to deal with it, some of these owners have harassed the tenants so badly that they're trying to force people to leave if they complain about the maintenance of their buildings. They figure if people are not working and not paying rent, they're going to take a break on the maintenance of the building. I kid you not. Or the cleaning up. And if anybody calls the health department, if anybody calls about anything happening and they need help, you're deemed as this bad tenant. And you could be paying money. You could have, I believe what they have is these declarations. You can send them in to your landlord, letting them know, signing them, letting them know you're going to pay the rent, pay what you can, at least 25% or whatever, even if it's less than that, whatever you're able to pay until things sort of get back to some normalcy, or you can get to work and they reopen your job and you're able to pay more to get caught up. But the harassment that is going to, some people have been evicted from places, and this ties into this vaccine stuff. Now I'm hearing that we might be looking at I heard that on the news they were talking about, just like you have a passport to go to different places, it shows you who you are, like an ID. you will probably in the near future be looking at having to have something that's like proof showing that you had the COVID-19 shot, vaccination shot, just to travel, because you're going out of state or going to another country or going to another location. You have to show that you had the vaccine and you're COVID free. And so if that's happening on flights, just think about jobs. Soon it'll be in the workplace where you have to prove, you have to show something showing that you are COVID free, that you don't have the virus. And so I knew it was getting to that. And so looking at this article here, people who are afraid, what's that gonna do? It's like basically saying that there's gonna be something that's gonna pretty much, in order for you to even have a job, where's that gonna put people you're gonna have to say, hey, if we want to work to feed our family, we're gonna have to get this shot. That's what it's saying. And so this is so controversial. I don't even think people really thought about it like that, how this is going. But I felt like it was going in that direction. Because every week you turn on the news, they keep talking about how bad it is, how many more people it is that are dying. Now they're talking about, now I'm hearing a turnaround. Oh, since people are getting the shot, we have more people getting vaccinated. The death toll is dropping. And I feel like that's a way to encourage people to get the shot, just to get it, because there's a race against this. Okay, there's these variants that are out there, all these other strains of COVID, and they want to hurry up and pump the shot into as many people as they can get it, to try to hold in hopes that it'll stop the spread of this thing, because it keeps mutating. And I'm hearing, where Dr. Fauci says, well, it can't mutate if so many people have been vaccinated, and, a lot of people have, some level of protection. Then I've heard some counter stories that you can still get the vaccine shot, but you could still catch COVID. And you just won't die. You might not. You'll be able to live. It's just so much confusion around this whole thing. So what do you do about a situation like this? It's so scary. You see what I'm saying? It's scary on all levels. It's like you don't know if it's good to get the shot or if it's not good to get the shot. Now you're feeling like you're going to be forced to get the shot if you want to survive. And then you don't know if it has side effects. Are you going to be the one that's going to get the side effects? And then people are afraid because you're hearing, okay, the death toll is dropping. Okay, maybe I won't die. I might have a side effect. It's like you're gambling with your life. You're gambling with your life on all of this. It's like you're backed in a corner and all the choices are hard and you don't know which one to go for. So you have to narrow them down. It's so crazy. But that's how this is feeling right now. But anyway, I'm going to let this go. So what do you think about this? This is crazy. It has been crazy for a lot of people. And the homelessness, oh my God, that's a whole separate issue. But it's coming more out of this situation. It's connected because people are getting evicted, because they can't go back to work, because their jobs have closed down, or their jobs are like yo-yos. 1 minute it's open, the next minute it's closed because somebody got sick. And I feel like they're hiding things. They as in some of the jobs hide how many employees have caught the virus. And I know my eyes are not deceiving me, but I saw an article said that they tried to reopen a school in if I was seeing it correctly, 85 students had to be quarantined. This was recent. This was like a couple of days ago. I saw this in the paper. that 85, they opened the school up. As soon as they opened the school, 85 students had to be quarantined. That's how bad this thing is. It's like LA has closed their schools because of that. Because they know we had some teachers that died. They weren't even, at an age where he's like, oh, they got health issues. There were some teachers that were young that died of this stuff. And so I think that's what kept the schools closed. Because people were like, hey, we don't want any more lawsuits and liability claims that we put people's lives at risk. I mean, it's really bad here in LA. I can tell you, it's everywhere, but in LA by far, it is really bad. The spread is out of control. It is. But the people that really need any vaccine, I don't think people are getting it, because if it isn't fear, it's you don't have access. There's a glitch when you try to even sign up to get the shot. I kid you not, I've tried it. I'm not gonna lie. It'll say, make an appointment, and here's the places where the appointments are available. And then when you finally get to that point, it says 0 appointments. Meaning, like, already it might have been appointments, but somehow within maybe a couple of hours or less than a couple of hours, maybe in seconds, those appointments are gone. As soon as they show up, boom, somebody goes in there and they have access to it. I don't know how it's happening. But this is so scary, these times we're in. There are people getting evicted, even though there's laws saying that it's illegal to evict people during such a vulnerable time. Can you imagine getting evicted and you lost your job, and it's not that you lost it because you got fired. You actually, your job had to close because they were told to close down because of the virus. And so they had to lay off their workers. So there's your money. And so you have to rely on EDD, which you hear all that scandal about EDD. And then some people are getting money, and it may be just enough to feed your family, but your landlord is harassing you to pay what you would have paid before this pandemic even began. They're harassing you. They want you to pay like you're working normal and everybody's well and there's no pandemic. This is how people are being treated in these communities. They were already rent burdened. You might have been a few weeks late, but you were able to come up with the money a week or two later, and you were able to get by. Now you're not able to even, you're skating, just barely skating by. But they're harassing the tenants, and they want you to pay $2,000, $3,000 a month in rent, and you're barely feeding your family. Thanks for listening.